Every 40 seconds, someone in America has a stroke or a heart attack. Two local hospitals are getting recognition for the life-saving care that many patients need in the moments that treatment matters most. The American Heart Association is highlighting East Liverpool City Hospital and St. Elizabeth Health Center in Youngstown for their efforts in the organization's Get With the Guidelines initiative. Dr. Mary Boylan is the immediate past president of the American Heart Association's Midwest Region Board of Directors, and she's also a heart surgeon. Doctor, thank you so much for taking the time to join us.
Oh, thank you. It's a pleasure to be here, and thanks for raising awareness about this topic.
Oh, yes. Yeah, the hospitals here in the Valley that you're recognizing, they have put in work to improve the outcomes for Americans with heart problems or strokes. What are the top benchmarks that they had to meet?
So when we think about heart disease, it is the most common disease around. More people die of heart and stroke than all the leading forms of cancer or even lung disease in this country. And almost half of all adults have some form of heart disease. So to drive improvement, American Heart Association has developed these guidelines. So Get With the Guidelines addresses a few different realms in heart and stroke disease. So in order to be recognized as participating with the Get With the Guidelines program, a hospital has to do a bunch of things. So it's not just one. So the goal of the guidelines is to provide a framework of consistent diagnosis, treatment, and follow-up for patients who have coronary artery disease, that's plugged up arteries that cause heart attack, or who have stroke, or who have heart failure. So by doing this, for a hospital to spend the time and energy that it takes to commit to providing best evidence-based care really takes a huge effort.
Here in the Valley, we're the home of an aging population, a lot of baby boomers also living here too. What does that mean to have this recognition, especially for patients now and in the future?
So this is really one of the most powerful things that an institution can do, because what it says is that no matter if this hospital participates with the Get With the Guidelines, the patient can go to that hospital, whether it's in a major city or a smaller town, and they can be assured that they will be given the best evidence-based treatment, which gives them the best opportunity for the best outcome. So everyone, if you're in a small town and this hospital participates with the Get With the Guidelines, you will be getting the same top shelf, best in class treatment that you would get if you were in a major metropolitan center. And that is life-saving for those patients who really have difficulties accessing a major tertiary care metropolitan hospital. So it is a huge commitment on the part of the community and the hospital, and just immense benefit for the patients and that community.
Okay, and we often talk about heart health here on 21 News at 5. What should be the top priorities for patients who struggle with heart disease or for someone who has that run in their family?
You know, that is, it's a simple question, and it's like a simple answer but a hard answer, because the first thing is knowing that there's some heart disease, and then the second part of it is being able to address it. So for someone who has a family history of heart disease, well, okay, they're not surprised if they end up with heart disease. But the first step, kind of is the easiest step, but the hardest step is to get checked out. So that means seeing your provider, your physician, your nurse practitioner, your physician assistant, and get evaluated so you know where your baseline is. Because when we think about it, almost half of all adult Americans in this country have some element of coronary cardiovascular disease. That means risk for heart attack or heart failure or stroke. And when we think about the fact that heart and stroke diseases are the #1 cause of death for us Americans, adults living in America, and that number far outstrips all the other cancers put together, you know, cardiovascular disease, stroke is going to happen to me, my family, my neighbor, my friend. So really important to get checked out. And that's the first step, is a hard step, but that's the first step, is to get checked out.
All right, we have great doctors that can check everyone out in this area. Great to have you with us. Thank you so much for joining us here at 5.
Thank you, a pleasure. And thank you again for raising awareness about this topic.
Absolutely.